Okay, so up next, we are doing our provider panel. We have our occupational therapist, Kelly, our respiratory therapist, Lauren, and then Kate is going to hop on and serve as our physical therapist for our provider panel. And then we also have Alex, who is Dr. Statland's nurse in our MDA clinic. So you guys can say hi to her. She's on if you have any questions about that, but I think we'll mostly stick with Kelly, Lauren, and Kate. If you guys want to introduce yourselves real quickly, and then we can open it up to questions.
Yeah, hi, I'm Kelly. I'm the occupational therapist that's in the clinic at KU, and I love seeing a lot of familiar faces and names today.
My name's Lauren. I'm the respiratory therapist at the MDA clinic on Tuesday afternoons. I also am a respiratory therapist up at the health system as well.
I'm Alex. I'm Dr. Statland's nurse for the MDA clinic, and I work alongside everyone else.
And I'm Kate Eichinger, and I'm at the University of Rochester, but I'm a physical therapist in our MDA clinic, providing physical therapy consultation there.
And she's our lead physical therapist for the FSHD CTRN, so she's very important to our network. So we'll open it up. You guys can unmute yourselves and ask questions if you'd like. And if there aren't any questions, we can start off with kind of what a typical visit looks like, maybe with a physical therapist. Kate, what are some things you guys do in clinic with FSHD patients to assess them from visit to visit?
I actually have a question.
Oh, go ahead.
So before the pandemic, I was doing pool therapy once a week, and for about a month and a half, 2 months, and it was wonderful. I loved it. With the pandemic, I haven't been back since, and so that form of exercise that's easier on your body, has been missing. I understand that it depends on where you live in the States and how high the case counts are, but do you think pool therapy is safe? Indoor pool therapy is safe to resume that with the chlorine and everything, or what do you recommend?
Yeah, so I've been closely following the pool world because I do have 2 daughters that are swimmers, and they have been back in the pool, and around here in Rochester, where the cases actually are pretty high right now, we have been okay engaging in pool activities without increases in COVID numbers. So I think certainly it is area dependent, and I would certainly look at what the rules and regulations and making sure that the environment is following socially distanced precautions, masking. Certainly if you're going for just pool exercise, you could certainly keep your head above water and keep a mask on, and hope that others are doing the same in your environment. But yes, certainly the pool is a great environment for exercise for people with FSHD. But I think it is just kind of making sure within your area that it's safe. You could also potentially look at, which may just offer another area of pool therapy, is some physical therapy locations have a therapy pool. And so that may be another option for a short term, is just doing some physical therapy through an aquatic therapy program, where they may have less numbers in the pool environment, more cleaning procedures, things like that.
Thank you very much.
I'm going to piggyback off that a little bit. I think one of the other things to kind of consider is a lot of areas, while they have the pools open, the changing rooms aren't. And to kind of put things in place for kind of the consideration of, once you get out of the pool, how you're going to kind of get home, that kind of thing. So, yeah.
Yes, I would agree here that, locker rooms are not accessible. So people, need to be able to have adequate footwear and clothing to be in and out of the pool without using the locker room.
I did not know that. Thank you.
There is a question in chat. Reed would like to know if Kate and Kelly can remind everyone of some best exercises for core strength.
So I can start. So certainly there are lots of different ways that you can do core and exercise, and I think it depends on the level of the involvement of the FSHD and how it affects your core muscles and what you're able to do. You know, certain things that you can just be laying on your back and contracting your core muscles, and laying on your back, contracting your core muscles, and then moving your legs a little bit. You know, certainly it's tough to not be able to show all those pictures and things like that. Another simple one that you can be doing maybe at home is sitting on slightly unstable surfaces, and moving your core in different directions to challenge yourself. So using, again, depends on your abilities and your access to things, but like sitting on an exercise ball can help from you know, helping with core stability exercise and core engagement, or even just sitting on, you know, foam surfaces if you have them at home. And like I said, you can do just contracting those muscles as a way to help engage the core muscles.
I like to really incorporate a lot of the core muscles and things that you're already doing. So if you're having to do any type of dishwasher unloading, do that, you know, kick in those core muscles as you're unloading the dishes and doing some rotational movements. So I think those are always good opportunities too. Yeah.
And I think I completely agree with that. And just to help people understand maybe how to kick in some of those muscles, you know, when I try to help people engage those muscles, and sometimes very difficult with people who have core muscle affected by FSHD, is really to try to think about bringing your belly button, kind of scooping it up and in along your spine, if that makes sense. So you're just trying to, you're not doing it with your breathing or holding your breath or anything like that. You're really just trying to engage those muscles by bringing your belly button kind of in and up along your spine. And then you can proceed, like Kelly was suggesting, doing things that you're already doing, which is great.
Lauren, there's a question in the chat. How would someone know if their breathing is affected? What are some signs or symptoms they might experience or they should look out for?
Yeah, anytime we have muscle weakness, it can obviously affect the respiratory system. We really, for any of you that I've talked to during clinic, I always talk about the diaphragm as being one of the major muscles to help you breathe effectively. So anytime we see any weakness in any of the major respiratory muscles, I will come in, and I'm sure Dr. Statland, you'll get this from Dr. Statland and several of the other providers when you come into clinic, but we do ask you, how is your breathing? Are you becoming shortness of breath? Are you short of breath at rest? Are you short of breath when you exercise? And then we also ask you about your sleep patterns. Are you tired in the morning? Do you feel like you want to go right back to bed when you wake up in the morning? Do you feel like you need that afternoon nap? And are you taking an afternoon nap all the time? Those are questions that we'll ask to really gauge your signs and symptoms of how your breathing is and how your breathing patterns are. If we have somebody who does complain of being really sleepy in the morning and really sleepy in the afternoons, that tells us that your sleeping patterns are not very good and that you're really retaining CO2. And when that happens, that's what makes you very, very sleepy. So then we worry that you're not breathing effectively when you sleep at night. So then that's where, again, we'll do the pulmonary function testing on you, which again, several of you, I've done testing with you when you've come into clinic. And then we really kind of gauge based off your symptoms and based off your numbers, where you're at really with your breathing patterns and your overall breathing and shortness of breath. There was a second follow-up here. Since COVID has hit, especially with our patients that we do see at the MDA clinic, absolutely, we've seen an increase in people who are concerned about the respiratory function. I would say at least once a week since March, I've had some patient, whether it's been in person or telehealth, relay to me that they're very scared about getting COVID and having that affect their respiratory status. Have I seen an increased number of patients looking for respiratory care? Not necessarily, if we're talking about COVID. I will say it was when we had to do a lot of telehealth visits in March and April, that was definitely a huge pivot for us as far as an assessment piece to really assess you with questions over the computer versus getting a good look at you in the clinic. So that was definitely a different way to assess our patients.
Okay, I think Jesse has a question. You can speak up, Jesse.
Hi everyone. So I have what would be considered, I guess, a more severe case of FSH. I was diagnosed at the age of 13, started using a wheelchair in my early 20s, and I've been using a power wheelchair full-time for the last 10 years. And so I haven't been able to safely walk in a long time. And until very recently, I've still been able to stand, so to put my pants on and things like that. But that has now become unsafe. I've had quite a few falls in the bathroom, and just for myself have determined that it's no longer safe for me to stand anymore even. And so I'm looking at getting a standing frame just so I would be able to stand and weight bear in a safe position and have some circulation going and whatnot. And I wonder if you've worked with any other clients who have progressed to the point where they can no longer stand or do any sort of serious exercising, and if a standing frame has been helpful.
So I think that's a great question. I have used standing frames probably with many different neuromuscular conditions. I have not used them a lot with FSHD, but I don't think that that means that they can't be used. What I probably would recommend prior to really pursuing one is maybe to try to work with a physical therapist to give it a try. And if you have, I don't know at KU if the outpatient physical therapy department, if you're close to them, to be able to, go and trial a standing frame and to make sure that it fits and feels comfortable and is something that would be beneficial to you. I mean, certainly, like you said, the weight bearing, the circulation, the range of motion, all of those things that you outlined are absolutely correct, and those are the benefits of a standing frame. Some of the positioning piece, I think, may be where I just would want to make sure that it's comfortable and not creating a lot of pain. So I think a trial of a standing frame would be a great idea prior to really investigating and looking at your insurance company providing something like that.
Mm-hmm. And I actually live in Canada. I love participating in all conferences and just staying abreast of what's going on. And there is a spinal cord injury clinic here in town, and they have a standing frame. So hopefully I'll be able to go and try one out soon once COVID is behind us, and start standing and weight bearing and stretching and getting some relief. Yeah.
That sounds like a great plan, and I'm glad that you know that there's one nearby that you can give a try.
Yeah.
Jesse, I can give you a patient's perspective. Also I've been riding a wheelchair for 25 years now. I do have a standing frame. I don't get in it frequently enough, but it is pretty wonderful. Riding the chair, as you know, you probably have very tight hip flexors, probably have lordosis in the back. All of that can be pretty uncomfortable initially. What I usually do if I'm going to get in it is work with some actually physical therapy students, and that's another story I can share with you. They'll stretch my legs and ankles and then get in there. And I've worked with the standing frame that has a seat back. So there's kinds that have a sling that go around your rear end. That may or may not be comfortable for you without some kind of back support. And I've forgotten the kind that I have, but maybe the physical therapist would know. It does have a tray table that sort of folds down in front of me with a chest pad. And so I'm getting support in the back and the front, and that helps keep me upright, but it feels great to be in it.
That's great. Thanks for sharing. I am looking at the Easy Stand Evolve,
Yeah.
and there's a distributor not too far away in Minneapolis, so hopefully. But thanks for sharing. Yeah, I would like to get back to swimming, but that creates a whole nother set of barriers, and I would have to bring someone to assist me or find a pool that has a lift. And in my hometown, there aren't a lot of resources like that in the community.
So Jesse, this is Terry. I don't know if they have something like this near you, but here in Omaha, Nebraska, we actually have something that's kind of similar to concierge service, but it's regular physical therapy. And they actually, instead of having a regular office, they have connections with like the local Y and like a swimming school here in town that's private, where the PT will come to your home, or you can meet them, like I would meet them at the Y for physical therapy. And instead of using a lift, a pool lift, they actually have a water wheelchair that's just made out of like PVC pipe and mesh with regular wheelchair wheels. And they would wheel me in and out of the zero entry pool. So I wasn't wasting all my time, you know, transferring. I transferred once to the water wheelchair. They wheeled me all the way in until I felt comfortable getting out and walking into the pool as deep as I wanted, and then worked with me there for an hour at a time. So it's billed as a regular physical therapy visit, which is wonderful. And I've worked with them off and on for the last probably 3 years or so, doing different things. They do home visits when it's too, you know, snowy outside and I don't want to get out in the elements, or if I'm too tired, then they would come here instead of meeting me at the pool. So I don't know if that's something that you can look into, or maybe talk to a physical therapist in your town and see if they would be willing to do something like that to help you.
Yeah, that's a great suggestion, Terry. Thanks. In Canada, we have pretty good healthcare, and so we do have access to free community PT services, but unfortunately, they will only work with you in your own home. So I'll definitely take your suggestion, Terry, and maybe look at hiring a private physiotherapist who might be willing to do some work with me at the pool, the one pool in town that is accessible. Yeah, thank you.
I actually have a question regarding the respiratory function testing that was discussed earlier. So I haven't had that in a while, but when I've done pulmonary, I think it's a pulmonary function respiratory test. And you know, you had to put your lips around this big tube and blow or suck in, and it was incredibly difficult. So when you guys are doing those tests, how do you accommodate for those of us that can't, you know, hold our lips around a big object, a big tube? Because that was incredibly difficult for me, obviously, with the FSH not having the facial muscular to be able to do that well. I mean, we try to get a baseline, but it was always very, very difficult to do that. So how do you guys adapt?
So how we adapt, we also do testing on Mondays in our ALS clinic. And so obviously we do have a lot of patients who do have facial weakness and can't really get that good lip seal around those mouthpieces. So we use actually what we call mouth seals. And it goes actually on the end of the mouthpiece, if you will. And then I really have to work with you, which is kind of the challenge as the patient when we do your work with you in timing it just right. So we get it in there, and then I hold the mouth seal, and because really the most common places we leak are right here at the ends of our mouth. So I will help kind of pinch those off, if you will. So then we either eliminate the leak or decrease the leak significantly.
Okay, great. Yeah, when when I did it, it was incredibly challenging, and I was trying to hold my mouth closed over the seal, and then my arms don't go up so high, and then I was hunching over, so it's hard to breathe, and it was just kind of a big old mess. So
yeah, we'll use mouth seals even in the hospital for for certain patients who have that inability to really get their mouth all the way around a mouthpiece. So we'll use those mouth seals with different therapies within the hospital as well. So if you're getting pulmonary testing, next time you go, see if they have a mouth seal that they could work with you to really kind of seal off those most common areas that leak.
I have a question on topic. May I? May I speak?
yeah,
Yeah.
Go ahead. Absolutely.
Okay. Hello, everybody. So elevated carbon dioxide can cause the fatigue. There's something that came up during the pandemic, and that was with Trump on reading the oxygen being below 94, normal range being 94 to 100. Is it the oximeter that you put on a finger to read the oxygen level to see that you're, well, we've got one of those at home, and I've been under 94 maybe for a very long time, and they put that as very grave for Trump in relation to his COVID reading. So, on all of my lab tests that I've gotten, they always are reading the CO2, which has been elevated, but I don't see anywhere in the labs anything reading about the oxygen. So Wendy, who I live with, hers is above 94 and just fine, but mine's consistently reading around 90. Is there any relation to the carbon dioxide reading that comes back in the tests as to what your oxygen might be?
So they're really, if we think about respiratory function from a physiological standpoint, the carbon dioxide is really the exchange and the breathing in and the breathing out. The oxygen level, with the oxygen level at the health system, when I work up at the hospital, we actually go by a saturation of 92% or better. And so if anybody's below 92, we'll obviously apply supplemental oxygen to them at the hospital. When we do testing, though, to get ready to send people home and we evaluate their oxygen, we actually will go by 88%.
Okay.
With
That's a little better than what they considered so grave for Trump being below 90. It was like,
yeah, well, with COVID
94.
patients, that I've taken care of in the hospital, we really have to be on top of their oxygen level because they will decline very rapidly as we continue to give them more oxygen. So we watch that very closely. Again, just at our facility, we do use 92 as that cutoff for inpatient oxygen administration.
Yeah,
Okay.
just a couple things. So typically when we think of a muscle disease, it's a problem with the bellows. The CO2 is typically where the problem's occurring. Now, remember, you may have other conditions that can affect oxygenation. For example, if someone was a smoker, this could make it more complicated. If it's a muscle problem, usually then just using things like a BiPAP at night, because at night's really where the problem is when you're lying flat on your back. That can be enough to normalize it. It's possible you would have another condition that might affect the oxygenation, so you should talk to your doctor if you're concerned about that. One thing about the little finger pulse oxes you get at home, there's a really wide variety of these devices out there. You want to try to find one that is FDA approved if you can. And you need to look at the little pulsometer it has on it. If your fingers are cold or you're not getting a good pulse reading, it's not going to be very accurate. And so it can swing quite a bit. So I usually say, for those,
Please, would you like an ERC?
Okay. Do we have more questions for the team? I do see one question about electromagnetic therapy called Emcella. And and this looks like it's being used on someone's core muscles. Do Kate or Kelly, do you guys know anything about this?
Nope, I have not heard of that. So I'll have to look into that.
Okay.
Yeah, same here.
I have another question. What do you guys think about infrared therapy as a treatment for pain?
Yeah, and so help me out, Terry. Do you mean you're going somewhere and sitting under a light? I mean, how does that work?
No, the same physical therapists that come to my house, so they have these infrared pads that go around your, well, around wherever it hurts. So they've done it on my shoulders, on my back, on my knees, my ankles. It seems to help, but I was just curious if you guys knew anything more definitive about it, if it's something that, I don't know. I just don't know I don't really know much about it. I just know that it doesn't hurt and it makes it feel better, but I don't know. It's just new, I guess. I don't really know that much about it. Does
it feel actually warm to you when they put it on?
Yeah, I mean, it's over like a 10-minute or so period that they leave it on. And then it's somewhat warm, but it's not hot. It doesn't get too hot. Just like these little kind of probes that it sticks out and kind of causes, they call it the bubble effect. So it kind of leaves like a pattern of kind of little, it looks like little bubbles on your skin when you're done, but it doesn't hurt. It's not painful or anything. So
I may punt this one to our physical therapists and occupational therapists to see if they've heard of this, because I'm not sure I'm familiar enough with the technique.
Yeah, I've heard a little bit about it. I think more from a neuropathy standpoint. You know, and I certainly would, you know, I'll take a peek at the literature and see what I can find and follow up if I find anything interesting that would be relative to FSHD or just in general pain. And Kelly, certainly jump in if you have some insight on this as well.
Yeah, I think probably what is going on is it's really more designed for pain and not specific to an individual. So I really haven't heard of it used. So like Kate, we'll be needing to look to see what the evidence is to support it, but it sounds like it's one of many types of strategies to alleviate some discomfort. Do you get long-term effect from it when they've used it? How long do you feel like you're getting any type of relief?
It's been a while since I've had it, so I think they would kind of do it on my once a week basis. That wouldn't be every time, but from what I remember, it kind of definitely helped like relieve the tenseness of the muscles, kind of like a massage, but maybe a little bit longer term effects from relief. But I haven't had it in, 8 months, so it's kind of hard to remember what it was. I just was curious if you guys knew anything about it. And then another, I don't know, I guess innovative approach that I've used, and I actually purchased one, but I haven't used it as much as I would like, is vibration plate therapy. Is that used in any of your clinics, and what do you think about that?
Not used at any of the clinics that I'm in. I know people have asked about it, and there's really not a lot of strong evidence to support it. So.
Yeah, Terry, do you mean when they vibrate, are they vibrating across your tendon? Where are they vibrating?
So it's a giant plate. Well, it's giant, I don't know. It's a large plate, and it sits maybe about 5 or 6 inches off the ground. And so I raise my wheelchair up, and I can either just place my feet on it and turn it on low for about 5 or so minutes at a time. but you can increase the intensity of the vibration, or yeah, there's different variations of how you can increase either the time and or the vibration itself. So I can either just place my feet on it to kind of help with, I do have some neuropathy, but that's more from cancer treatment, not from the FSH that I know of, because I didn't have it prior to doing cancer treatment. But also just the, you know, I don't have very good, my feet are cold all the time. I don't have very good circulation in my legs, I feel like. So just kind of waking up those muscles, and it's also been used to help with balance. I was actually able to stand and do kind of, with a physical therapist, do some, you know, kind of weight shifting from my feet, different, you know, I'd step side to side, I would do leg kicks back and forth, that kind of thing, with a physical therapist on the vibration plate. And I could literally stand on the vibration plate for like 15 to 20 minutes at a time, whereas I can't even stand in the kitchen and make dinner for 20 minutes. So it was really interesting that I was able to do that, but I think it was just, you know, it kind of helped with the balance and with that sort of thing. So I wasn't sure if anybody else was using something like that, or what you thought of it.
I'll hop in just because David LaFountain, I know he doesn't have a mic, but it sounds like what David LaFountain is using with his physical therapist is not like super similar, but somewhat similar, because he's using the electromagnetic therapy. And he says that after a few treatments, he's able to stand for just short periods of time and feels relief. And it's supposed to help build his muscles.
Okay, what I think I'm going to say, I think this is really fantastic. What I'd say is maybe what we'll do is let's collect some of the things that people are trying, and we can put them together and see if we can get some more information and then distribute it back to people after the meeting. Because I think this is one of the ways that we can share and learn about strategies that people have that have been helpful. Kylie, do you want to go ahead and introduce the next portion of the day?
Yes, so I just put a message in the chat. If you guys want to send me some of the things that you're using, I can compile a list and distribute it to our PTs, Dr. Statland, and we can do a little research and get back to everyone.